Good morning. I want to welcome you to our Friday press briefing with updates on COVID-19. Please join me in a moment of silence for the lives we have lost due to COVID-19 and for the families they leave behind. Thank you. Now we will hear updates from our community leaders, and first we'll hear from City of Albany Mayor Bo Durrell. Mr. Mayor?
Thank you, Chief. I don't know if good morning. I don't know if my slides are in, if Mr. Cox could work with us. I just have a few comments today, and it's mostly going to be statistics. The first slide you see, those of you who've read the Albany Herald this morning know that the number of COVID patients in state hospitals today exceeded, if we can let Dr. Black in, exceeded the previous high point in July. We are in what experts call the third wave of the coronavirus. The pandemic. I just want to give you some statistics. As most of the public knows, we have a task force, have a teleconference every Wednesday. We get updates from Phoebe, we get updates from public health, we get updates from the coroner, the school system. And if you go back into the spring, there were 3 benchmarks that were in most of these recommendations for reopening the economy. One was the number of patients you had in your local hospital. 2 was what's called the positivity rate, and that's the number of people who are being tested who are positive for COVID. And third is the number of people per 100,000 population who test positive. I went in preparation today, I went back over my notes from the task force meetings. On November 18th, the report from Phoebe was we have 23 COVID patients. At that time, they had 4 patients on ventilators. On December 2nd, Phoebe had 36 COVID patients. And then on December 16th, Phoebe had 70 COVID patients, 15 of whom were on ventilators. That's the rate for the hospitalization. Now, the positivity rate, the city IT department obtains reports from the hospital, from public health, and private collection sites. Those are practices and clinics which are administering the test here in Dougherty County and give you a 14-day positivity rate. The city manager gives us that report. At the November 18th meeting, for the 14 days prior to that date, of those who tested, only 4% were positive. 2 weeks later, December 2nd, the city manager tells us for the last 14 days, 6% of those who were tested were positive. And on December 16th, Ms. Subadan reports that 11% of those who were tested were positive. Clearly, you see with the numbers from Phoebe and the positivity rates, we're having twice the infection that we had just a few weeks ago. The numbers from the Department of Public Health, and Dr. Ruiz has pointed out that Department of Public Health figures are somewhat slow as more and more testing is being performed, particularly the rapid antigen testing at private clinics. The Department of Public Health is not getting that information as promptly and in some cases at all from private collection sites, whereas hospitals and Department of Community Health automatically submit those reports. But on November 19th, if you go to the Department of Public Health website, you will see that in Dougherty County, our infection rate was 64 per 100,000 population. On December 3rd, that had risen to 106 per 100,000 population. And on December 17th, it had risen to 260 per 100,000 people. And again, Dr. Ruiz has pointed out in his reports that the number is obviously higher than that because we're not getting all the reports from private clinics, and it's only measuring those people who are being tested. And as we know, have known for 6 months or more, that a lot of people have the virus, are never tested, and therefore they're never confirmed. Now, one thing I want to say, and I'll close this down, I sort of come to the conclusion that the folks who are tuning into these press conferences is sort of like we're preaching to the choir, that people who are attuned to what's going on in the community realize the severity of this situation. We are all tired of the safety precautions, what the journalists call COVID fatigue. On the task force a week or two ago, somebody pointed out that during the holidays, we naturally want to be with family and loved ones, and there's some way we can justify, well, we'll just go to this place or that place, or we'll meet here or there. But what we have seen from Thanksgiving, the same thing we saw July 4th, these holidays, we have large gatherings and the numbers spike up. We're going to see this again at Christmas because people are going to get together and infect one another. And this is what I want to show. If we could pull that up, Mr. Cox. This is Dougherty County. It shows you that the number of people who are under the age of 60 who have been tested positive is fully 72% of the population. Now, if we can see the next slide, and these were provided by Dr. Ruiz, Ms. Cox, those who have died, 83% are 60 and older. Now, if you go to the Department of Public Health website, you'll see that the vast majority of the people in the state of Georgia who have been infected are under the age of 50. Very few of these people required hospitalizations, and less than 600 of the approximately 10,000 people who have died from COVID in the state of Georgia were under the age of 50. Now, we've just seen in Dougherty County, it's pretty consistent with what's true all over the country, that the people who are dying are over the age of 60 and particularly 65. What I want to show you now, and they saw this in Chile during the spring, if we could. This was the infection of influenza in the United States for the week ending December 7th, 2019. You see those rates, okay? Ms. Cox, we go to the next one, please. You missed it. Have we got? Okay, well, I was afraid this would happen. This is the influenza rate for the week ending December 5th, 2020. The infection rate of it, that is, thank you, Ms. Scott. Okay, what you see there is very few people are contracting influenza, and the experts say this is directly a result of people exercising safety precautions in connection with trying to combat the coronavirus. What I am saying, or trying to say today before we go into the Christmas holidays, is we all need to be cognizant of the fact that the people who are most vulnerable are 60 and older, and we need to exercise these safety precautions because the number of deaths is increasing. The number of deaths in the country are approaching or exceeding 300,000, and now some experts are saying 100,000 people will die in the next 30 to 45 days unless we avoid large gatherings during the Christmas holidays. So thank you for your attention, and please not only follow the safety precautions, but what we need to do, those of you who tune in every 2 weeks, we need to make sure other people are protecting themselves and others as well. Thank you.
Thank you, Mr. Mayor, for your comments today. We will now hear from Dougherty County Commission Chair Christopher Cohelas.
Thank you, Chief. Thank you, Mayor. I want to talk about some data today and some numbers that I recently got from Daugherty County EMS. The Mayor did a very good job of explaining how the numbers are going up. The numbers are going up across the state and across the country. We went through our very first big wave initially before most of the rest of the country did, and we did a very good job of combating that. But we have seen a significant spike since Thanksgiving. We have a lot of things that are going to be going on over the next couple of weeks that are going to naturally bring or motivate people to get together into certain gatherings. And it is very important that we take necessary precautions, because what we're talking about is a problem that can grow exponentially. We have a large number of people that got together during the Thanksgiving holidays. Those folks spread the virus, and then they've spread it again. And so what happens is when we let our guard down too much, or we don't engage in the practices that allow us to stay safe and that allow us to keep our medically fragile and our elderly folks safe, it grows, and then we have more hospitalizations. We know, as a matter of fact, that we have a lot of people that have the virus and don't ever know that they have the virus. And in fact, one of the interesting pieces of information that I've learned from our EMS folks is that the way that the virus is presenting itself at this time in our community in certain instances seems different than it did several months ago. We have a lot of people that are presenting to EMS that simply just don't feel well. And instead of dealing with a lot of upper respiratory problems, they're presenting with symptoms that appear more flu-like, more nausea, more vomiting, more diarrhea, things like that that people don't typically associate with the coronavirus based on what we've heard so far. And what we've learned is that many of these folks who've been sick for 2 or 3 days, just not feeling well, and that have nausea, vomiting, diarrhea, those types of icky symptoms, that they're ultimately getting transported to the hospital, and that we're learning that they have actually tested positive for COVID-19. So it's very important that we do a couple of things. One, it's important that we educate ourselves on the full range of symptoms that the coronavirus has. Also, let's pay attention to the trends that we have going on in our community at this time. That's very important. And this is information that comes right from the ground, from the folks that literally take our loved ones from their home to the hospital. And they're seeing this, and this is a trend that we're currently seeing. And it's important to understand this. What's really important about the coronavirus in managing it is making sure that we have enough hospital space, making sure that we have enough respirators. And I remember, and I was part of the phone calls along with the mayor and many other leaders, as we were scrambling as a community trying to find ways to get greater access to more respirators back in March and April and May. Because literally we had so many people that needed respirators that we had to bring more in order to support them. I'm very thankful for the fact that we were able to get those respirators, that we were able to get Phoebe North stood up and have a COVID-19 facility there. And we're very well prepared, but we have to be conscientious of this fact. Right now, as of today, as of the latest report that I have, we have 63 people in the hospital. That's 63 loved ones, 63 grandparents, moms, dads, uncles. That's a lot of people to have in the hospital, and we're doing a much better job as a community in making sure that people are coming off of the ventilator, and that's a very good thing, but it's still very trying. And we had Thanksgiving. We've had a significant increase in the number of cases. That means that there are more people in our community that can infect more people. And we have Christmas, we have New Year's. These are times when people naturally want to get together in large gatherings. And now we have more people that have the virus from Thanksgiving rolling into these weeks where we have these natural opportunities to have family gatherings. It's very important that we don't have large gatherings, that we don't let our guard down. I'm not saying that everyone has to lock themselves into a closet, but make smart decisions, as many of us have. And let's make the same smart decisions that got us out of a tremendous crisis back in March and April of this year. Let's continue to embrace and continue to lead as a community in showing how we can continue to manage this better than other communities, because we've done an outstanding job at a community level. We've really done a great job at a community level, and without y'all's participation, we could have never overcome what we overcame in March and April of this year. Again, and I want to talk about just some of these numbers. In early March, we had a total of 1 positive call in terms of EMS, the very first week of March. And then it quickly escalated to the point where by the end of the month, in the beginning of April, we had 72 people that were transported to the hospital in 1 week that tested positive for COVID-19. And then we took tremendous action, swift action, harsh action, in order to make sure that the community was safe. And we brought that number back down. So it literally was like a train going up a track, up a hill, and it started to come right back down, and we sort of leveled out. But what's concerning to me is that the number of patients that are the number of people, the number of aunts, uncles, brothers, cousins, grandparents that are being transported to the hospital for the past 3 weeks has been on a steady increase. On November 16th to 22nd, we had 6 people that were transported that tested positive for COVID-19. The next week, we had 14 people that were transported in Dougherty County to the hospital that had COVID-19. The next week, November 30th to December 6th, we had 14 people that were transported to the hospital that had COVID-19. And the week of December 7th to December 13th, we had 18 people transported to the hospital that had COVID-19. Those are folks that are not just at home and that have mild symptoms. These are people that require hospital care, that require admission, people that have to be evaluated to determine what types of medicines that they're going to be on, whether or not they need additional treatment, whether or not they're going to end up on a respirator. And it's important to me that we keep the number of people that fall into that category as low as possible. And it's very, very important, because it's not only important to those people and their families, but it's important with respect to the resources that we have. And also understand this: we are, back in March and April, I had no idea if we would ever see a vaccine. And we are seeing a vaccine. We know, and very thankful for Phoebe's partnership. Phoebe has done a phenomenal job throughout this entire crisis and has truly led and been a leader and a partner with the county and the city in combating horrible circumstances. And they have purchased the equipment, purchased the capital, made the investments necessary so that they could position themselves to be able to receive vaccines. And I was thankful to hear that Phoebe has received 5,000 vaccines. And I'm sure that Dr. Black is going to talk about his experience with the vaccine, understanding what that means and how it's going to be deployed. We as leaders are learning that information in real time, and as soon as I have better and more detailed information on what the availability of the vaccine is, what the circumstances or the side effects or the potential side effects of the vaccine are, I'm going to share that information as well. I know that we're going to get great information from our medical professionals. I know that there are multiple different types of vaccines. Some are a one-shot deal. Some are a two-shot deal where you literally have to go in 1 week and then you go in a second week. There are some really important nuances and details about these vaccines that I really want to encourage everybody learn, and don't just go to social media where somebody that is a coffee shop pretend doctor just hammering away on their cell phone, putting out information, professes to be an expert. Look at credible news sources, read credible articles, listen to the doctors that will speak here about that information, because there are a lot of very important pieces of information that are associated with these vaccines. And it's important information for everyone to hear and receive in making their determinations on how they personally want to move forward in terms of taking the vaccine or not. But we're in an unprecedented crisis in the country and in the world. None of us, not a single human being, I would dare say, in Dougherty County or in the world, ever thought that we would be in this place today. But we do have a lot of options that are starting to present themselves here in our community and across the world. And I'm thankful to be an American, and the fact that the United States of America has produced these results, and that they're options that we can evaluate. Some of the things, the high points of some of the things about the vaccines that I've learned. Some of the vaccines, are 90 to 95% effective, as I understand it. But it's also interesting that while it may vaccinate you, it may not remove your ability in certain instances to actually still receive the virus and transmit it to someone else. And that was a fascinating piece of information that I learned, that you can get vaccinated for something, but still be a carrier for the precise virus for which you were vaccinated. And I think that these are pieces of information that we're going to continue to digest as a community. I'm going to ask a lot of questions. Look, I'm a father as well as a leader here in this community, and I have to make decisions for my family. I want to make sure that I get all the information. I understand all the potential side effects and the benefits. And I'm very thankful that we're here in this position. I'm very thankful that Phoebe is a partner that has been capable of receiving 5,000 vaccines. And if you think about that in terms of, that's a really big deal. We're Albany, Georgia. Many folks think of us as just sort of a big small town nestled in southwest Georgia. For us to be able to position ourselves during a worldwide pandemic, to be capable of receiving 5,000 vaccines in the midst of all of this that's going on, is something to truly be thankful for. And I say all of that to say this. We have defined ourselves as a community by how we respond to adversity. We did that in 2017 with the tornadoes, 2018 with Hurricane Michael, and now in 2020 with respect to the pandemic, where we were number 3 in the world. And we have beaten back adversity with a stick. However, it's important that we do not fall asleep at the wheel, and that we continue to run this marathon. And remember that it's not a sprint, but a marathon. Thank you.
Thank you, Mr. Chairman, for your comments today. We will now hear from our representative from Phoebe Putney Memorial Hospital. Very fortunate today to have with us Dr. James Black, who is the chairman of the emergency department. Dr. Black.
Good morning. I'm going to remove my mask, because a lot of us, we can choose to wear our mask or our glasses, can't wear both of them at the same time. At least I have a hard time with it. First of all, just to give some numbers, and we've heard how the numbers are escalating. As of this morning, we have, throughout our hospital system, a total of 81 total admitted COVID patients. Okay, it's throughout the system. Some of those are from our county, but we're also receiving transfers in from other hospitals and other health systems as we're able to help out to a certain extent with the management of those patients. As the mayor pointed out earlier, in mid to late November, we had gotten down to 23, and we're up at about 3.5 to 4 times that amount, and that number is steadily rising. And we think that some of that may be due to the recent Thanksgiving holidays when a lot of people chose to gather. And we're certainly a little bit apprehensive as we approach the Christmas holidays that this may continue and potentially get worse. I will try to touch and answer some questions about the vaccine. As many of you have heard, we received our first installment of vaccines. We received at the main campus 5,000 doses of the vaccine, as well as 1,000 at Phoebe Worth, and I began administering those yesterday afternoon. I was the first one to actually get the vaccine in this part of the state, and happy to say that I'm upright. I had a little bit of left shoulder soreness, but otherwise I feel great, and my shoulder's not sore anymore. So I haven't had any other ill effects, and I'll keep you guys posted. We administered yesterday about 150, a little bit short of 150 vaccinations yesterday, and it was part of our plan. We kind of wanted to test our process, test our system, test the tracking, and we're set up to deliver a much larger amount of vaccines today and the coming days. And we have a plan that we're following according to CDC recommendations and guidelines as to tier those people who may be at a high risk, medium, low, or minimal risk as far as the healthcare workers are concerned. So we have our entire roster of all the people that work at the hospital and associated with this. And I want to emphasize, this is not just physicians or nurses or our PAs or nurse practitioners. This includes everyone with the role at the healthcare facility. So that will include our environmental services. That will include registration. It includes our techs, our radiology techs. So everyone at the hospital has been tiered according to their risk of coming into contact with patients that are potentially infected. And it's just a way for us to stratify. And again, this is not something we came up with. We're using the CDC recommendations. And we will reach all of those employees who choose to have the vaccine. And I put that in that term, who choose to have the vaccine, because it is not mandatory, but we're strongly encouraging vaccination of our employees and of the public at large as we're able to deliver those vaccinations. I also want to make everyone aware that it's not just the Phoebe employees. To those physicians that are not necessarily employed with us but do work at the hospital, we're offering vaccinations to them and their staff as well. So again, we're tasked and charged, and our mission is to take care of the community at large, and that includes our healthcare partners that are not necessarily a part of the Phoebe family, but that we do work closely with. That also extends to our first responders. And again, there's an extensive list about how we're going to roll these vaccinations out, but our first responders, our police, our fire, our EMS, and others in the community, we're going to be rolling the vaccine out and make it available to everyone that chooses. The vaccination, and I heard Chairman Cohilas mention that there are several different vaccinations in various stages of development. The only two that have been approved at this point in time for emergency use are the Pfizer and the Moderna. And we have received the Pfizer doses, and as I said, we received the 5,000 doses, which was the maximum we could receive. And we took those doses and we received them, but we also have Moderna on order as well. They are both two-dose vaccinations. I think there's only one vaccination that's currently in development that is a single dose, but it has not been approved yet. So the only things that are approved are two-dose vaccines. I will stress to you that when you get one type of vaccine, it's important that you get the second dose of that same vaccine. So you can't take one dose of the Pfizer and then get one dose of the Moderna. So whichever one you start with, you're going to make sure you get the second one of the same one. The vaccines work in a similar fashion, but they are not identical. So we want to make sure we use the same vaccine when we get the second one. Some other things, a couple of rumors and a couple of things and concerns. First of all, let me say I am glad that people have questions about vaccine. In my mind, when people have questions, they're paying attention to their health and to their well-being, and it's a chance for us to share information. So I'd like to just tell you a couple of things that people have asked me, and I want to try to answer them as best I can and try to allay some of those concerns. I get often asked about, a lot of people say, well, it seems to me that the vaccines is very quick in their development. And I want to tell you that I'm not sure how you define quick, but it's been nearly a year that people have been working on the vaccines. The U.S. scientists actually got the genetic sequencing back in early to mid-January before we actually had any confirmed or diagnosed cases in the United States. So that information was made available to us, and the vaccination process had begun. So again, it's been a year in making. A couple of things that helped us speed this along. Number one, technology has obviously improved over the course of the last several years and several decades, making some of the process steps move along more quickly. Additionally, this vaccine does not use live or killed virus particles. So some types of vaccines that do use live particles, use live vaccines, take time to grow those vaccines and to incubate them and grow them to sufficient numbers in order to perform testing. That step was not necessary because this does not contain coronavirus. I want to say that again. You are not getting a vaccination that contains COVID-19, and that's a concern of a lot of people. Also, the thing that I like to point to the most, this is the first time in recent history and that I'm aware of that the entire world's top scientists and researchers are working on the same problem at one time. So as opposed to thinking this was rushed, I tend to like to think this is what happens when we all work together toward a common goal, and that vaccines have come to be useful for us inside of a year's time. So I don't think the process was rushed. I don't think there were shortcuts that were taken. I think we have been the benefit of a collaborative effort and of scientific advancement. The vaccine is thought to be safe, thought to be effective, and so that's one of the reasons I chose to take the vaccine early, because I certainly wouldn't want to ask anybody that works with me to do anything that I'm not willing to do. So again, we view this as a major milestone, but a couple of things that I want us to keep in mind. As Chairman Cohilas began to allude to, the vaccinations are not the be-all, end-all. Once I get the vaccine, I no longer have to worry about it. That is not the case. First of all, it will take time for your body to develop the necessary defenses that the vaccine will help, but it is not all ending for the vaccine. We're still going to have to make smart choices. Wear our masks, limit our gathering, wash our hands, maintain social distancing. All of those practices that we first enacted back in March and April when this first hit us that helped us drive down the numbers, those things still need to be practiced. Also, as he alluded to as well, vaccinations do a few things. They will lessen the likelihood that you will get the disease. They will make it disease, or they will lessen the effect. If you do happen to contract it anyway, they will lessen the severity of the disease. They will make it less likely that you will transmit it to others, even when you're asymptomatic. But again, there's not 100% protection against any of these, but it improves your chances with all of them. So again, vaccinations in connection with our other practices are what's going to help us drive the numbers down. So I want to make sure we understand that this is just but one part of how we're going to continue to turn the tide and beat this pandemic. So again, I want to leave you, wear your mask, wash your hands often, limit your gathering. As Christmas is upon us, there's going to be a desire, and out of habit and custom and out of wanting to be our family, to get together. But just because your family loves you does not mean that you cannot get sick when you come around them, okay? Make good choices. Make good choices. And as the vaccine becomes available to the community at large, I encourage you to do your research, but to get the vaccine. And I'll keep you guys posted on my progress and the progress of my colleagues and those who have gotten it. Thank you very much, and have a good Christmas holiday.
Thank you, Dr. Black. Very informative. And also, we will pause just for a moment to mention Dr. Stephen Kitchen, who Dr. Black and Dr. Kitchen have been with us since day one of trying to address COVID-19 in our community. And we want to wish Dr. Stephen Kitchen, the Chief Medical Officer, Phoebe Putney, our very best in his retirement. And so if we don't see him again at this podium, we certainly thank him for his contribution to our community. So thank you, Dr. Black, for being here today. We will now hear from the Director of the Southwest Georgia District of the Department of Public Health, Dr. Charles Ruiz. Dr. Ruiz?
Thank you very much, Chief. Okay, when we talk about statistics and reports and so forth, sometimes there are slightly different ways of looking at them. And I heard what the mayor said earlier about the new cases in Dougherty County, and I agree with what he said. I just want to be clear because I'm offering a number that's a little bit different. And I believe, Mr. Mayor, you were referring probably to the number of PCR confirmed cases in Dougherty County. But in addition to those numbers, we're seeing a lot of the rapid antigen tests being done. And so if you add the rapid antigen numbers to the standard test, the PCR, if we look back for 14 days, the number of new cases for Dougherty County per 100,000 population would actually be 452. And one reason I want to mention that is because if we were to go back 1 week and then take that 14-day look back, the number of new cases of PCR and rapid antigen would be 371. So in 7 days, Dougherty County has gone up over 20% for new cases. So I just want to underscore that I agree with the mayor that the cases are going up, and that's really true for almost every county in Georgia. 452 is not a good number, but believe it or not, there are many counties in Georgia, particularly in the northern part of the state, where they have 600, 900, or 1,200 new cases in 14 days per 100,000. I want to mention that in part because if we're considering travel plans over the next few weeks, please think twice and 3 times about it, because you may be traveling to a location that's actually sicker than where you came from. So we are all delighted that the vaccine is here. It's great news. We've been waiting on it and praying for it, and we do believe that it's safe and effective. But I want to underscore the fact that the vaccine does not at all lessen the need to adhere to the basic strategy that we have employed since the beginning of this pandemic. It is still very important that we remember to distance ourselves from others and to wear masks, particularly when we can't distance ourselves, to keep our hands clean and to keep commonly touched surfaces clean. And by all means, stay home if you're sick. If you have symptoms that are at all consistent with COVID-19, please call your healthcare provider and stay home and listen to the advice of the healthcare provider. Perhaps it would be a good idea to get tested. So we've talked some this morning about where we've been and where we're going. And I just want to offer this image to you. We can clearly remember where we were the first week and the second week of March of this year. And I think that I can say in our own defense, we didn't really know what was coming upon us. We didn't really know at that time how to deal with it. And we were sort of at the mercy of the virus in the first week of March for this year. Let's consider the first week of March of 2021. We don't really have any excuse. We can determine pretty much where we're going to be this coming March. We have the knowledge, we have the experience, and now we have the medical technology to really fight back against this virus. The vaccine is not yet available in large quantities, but it is available in significant quantities, and it's already being used here in Southwest Georgia and around the state and around the nation. In weeks to come, we're going to see the numbers of this vaccine delivered in much larger quantities. We're going to adhere to the national plan to prioritize the use of the vaccine. Eventually, it's going to be available for everyone who is eligible for it. But it just makes really good sense to start with to protect those who take care of us if we get sick. So for that reason, healthcare workers are at the highest priority. And along with that goes people who live in congregate settings, and that would include nursing homes, personal care homes, dormitories, and jails and prisons. We need to get those people vaccinated as soon as we can. So that's where the first allotments are going to go to. And public health in Southwest Georgia has not yet received an allotment, but we think we're on the list to receive some in the next week or two. And we want to help vaccinate the healthcare people in the community that are unvaccinated at that time, and also people who live in congregate settings. So what we would like people to do is to go ahead and, in effect, register with public health. If you own or operate a medical organization or a long-term care facility, then we would like for you to go to the Southwest Georgia Public Health webpage, and within 24 hours from now, we will have a link there that will take you to a short registration form. You can tell us who you are, tell us who your contact is, and describe your organization, and we will put you on a list. And then as soon as we have the vaccine, or as soon as we know that we're going to get it, then we will reach out and see if you still need that service and do our best to provide it for you. And then as time goes on, when the vaccine is more available, we will likely offer that same service to businesses throughout the community. However, right now we're focusing on healthcare organizations and congregate living settings. A good bit of information has already been shared this morning about the slides, and so I want to talk a little bit more, and I think I should switch glasses. But a few of the facts of the COVID vaccine have already been mentioned. I would like to add and stress the fact that no one will be expected to pay any money out of their pocket for the COVID vaccine. So there's no financial barrier. And we've talked about the prioritization. And I think it's already been said that this vaccine is up to 95% effective, and that is tremendous. There are very few vaccines that we use today that surpass that 95% mark. Also, I want to talk about testing. Testing is still very important. The demand for testing has gone up recently, and rightfully so. We need that, particularly when the new case numbers are going up. Here in Dougherty County, testing is available today. It will be available for 4 days next week, Monday, Tuesday, Wednesday, and Saturday of next week. It's easy to get a test, and we want to ask you please to pre-register, because if you just show up without pre-registering, we may not have enough testing materials. We may not have enough staff members, and it will take longer to get you registered, and the line is just going to go slower for everyone. One great way to pre-register is to go online to covid19.dph.ga.gov, and you can register online. You can see what times are available, and you can see locations outside of Dougherty County. We have quite a few around Southwest Georgia, and you can pick and choose the one that's best for you. Another easy way to do is to make a phone call to 229-352-6567, and we have operators there Monday through Friday who can make an appointment for you. We have a large staff of people working for our epidemiology department in Southwest Georgia, and that's true around the state. We have many case investigators and contact tracers. Their job includes calling people who have tested positive to make sure that they understand the importance of isolation and the duration of isolation. During that phone call, we also extract the names of those people who have been exposed. And then our contact tracers will get in touch with those people who have been exposed and talk to them about the quarantine measures. So the common denominator there is phone calls. For us to do our job and to do it effectively, we have to be able to communicate with the public. And we all know how annoying unexpected phone calls can be. But during this pandemic, we want to ask you please to answer your phone, because it could very well be a call from public health calling you with some very vital information that could be actually life-saving. So let me close with this, just to remind you that we're still in the pandemic. People are still getting sick. People are still getting hospitals, and people are still dying from COVID. It is way too soon to celebrate victory, but it is within our grasp if we will apply the knowledge and the medical technology that we have before us. Thank you very much.
Dr. Lewis, thank you, sir, for your presentation today. We haven't heard an update from our emergency medical services in a while, and we'd like to receive an update today from our emergency medical services. We have today Dougherty County EMS Director, Mr. Sam Allen. Mr. Allen?
Good morning. Just want to kind of go over a few tips with you and let you know what's coming up for, especially with the holidays as they're getting much closer. What you've heard today from the mayor, what you've heard from the commission chairman, Dr. Black, Dr. Russ, everything is true. The numbers are going up and we're seeing it in our community. So remember, where we're at today is almost where we were at in July. Please do everything you can to help keep the numbers down. We don't want to go back up like we were. Now we have the holidays coming up. So remember, if you're going to have anything at your house, please use single-use items. Examples, condiment packs, disposable cups, plates, utensils. Limit the amount of exposure that you have in that situation. Avoid sharing food and utensils. Continue to use good hand washing techniques. I can't stress that enough. That is one of the most important things, that and a mask. Keep social distance. That is very, very important. Limit your group activity. We all want to be together during the holidays. We all understand that. But we do have the virus. And if one person brings it in your house, they can spread it to 2 or 3 people that's in your house, and then they take it and spread it to another house that they go to. So please help us. Let's keep the virus down. Wear your mask. Most importantly, have a spare mask with you. It's easy to get out of the car and forget to put your mask on, but you've got a spare one in your coat. Have a spare mask available. Get a flu shot. So remember, Christmas and New Year's is coming around. We want to limit the amount of the spread of the virus. Avoid crowded areas. If you don't feel comfortable, step back, go somewhere else. Poorly ventilated areas that are indoor, avoid those. These are areas that will spread the virus as it continues to grow in our community. So most of all, we are seeing an increase. We're seeing difference of the vitals that the patients were presenting back in March, April, May. It's somewhat different that we're seeing in the patient assessment that the paramedics are experiencing. So it's hard to tell who has, who doesn't have the virus. You just don't know. When you're bringing people into your house, you're subjecting you, your loved ones, your grandparents, your parents, your sons and daughters, grandchildren. You're subjecting to all them to the potential of the virus. So please use extreme caution. We are seeing an increase in our community. Thank you.
Thank you, Mr. Allen. We will move now to an update from our coroner, Mr. Michael Fowler. Mr. Fowler?
Good morning. Thank you, Chief. Thank you for each one of the presentation that we have been went over this morning so far. Everything seemed to be on an uprise. One positive note, the death rate seemed to be trending down, and that's a good note. At this present time, we at 201. The last time we talked, I think we was at 199, so we have 2 more deaths that have happened in Dougherty County. That was positive. We have 1 Asian, 1 Latino, we have 47 white, we have 152 blacks. Gender, we have 113 females, 88 males. Race and gender, we have 1 female agent, 1 Latino male, we have 30 white females, 18 white males, we have 81 black females, and we have 70 black males. you know the trend from March, like everyone has spoken from March, April, May, we was in high. In July, we was at 12. It went on an up spike, I think, maybe from the holidays. August, we had 15. September, we went down to 6. And you can see we went down to 6 the next month. In November, we had 3. And as of December, we just have only 2 deaths. We'd like to keep it there if we possibly can. Like I said, in the last couple of weeks, we just only had 2 more deaths. That's not the number one that went to the hospital. I think we have a great medical professional. The medical field is doing a great job in saving lives. So, as Mr. Sam Allen said earlier, is once you start having symptoms, when you be notified the EMS and different ones to come, get you. Don't be hesitating, trying to hold up saying I just may have a little cold or something. You start feeling some of those symptoms coming on, go get tested or go get checked. The sooner the better. I want to say, as everyone have said, I think the Christmas holidays are coming, and we definitely going to have gathering. Please mask up. They're going to be one of the most key things, and said, practice social distancing and washing your hand. I want to say, just be safe. Every one of us love to see all our families, grandkids, and kids to come in. But I think this one Christmas day going to be different from any other Christmas that we ever had. And to look forward for the following Christmas. But right now, gathering in a house and so many people, one person can contaminate many others. So I want to say be safe, and I hope you have a Merry Christmas. But again, like I said, we got to do this together. It can't be just a certain segment of people, but we all got to come together and do this as a team effort. Thank you.
Thank you, Mr. Fowler. We will pause for questions.
Obviously, with the COVID vaccine arriving here in Albany and Bertie County, we are looking to our leaders of our community for advice and guidance. What does the city and county plan to do as far as promoting this vaccine? Is there a plan together for that yet?
Yes. But what I'd like to call on Mayor Medoro to come up and provide some encouragement to our citizens. Mr. Mayor?
I can't speak for the city because I think this is a medical decision as opposed to a political decision, and we need to follow the advice. I mean, Dr. Black has addressed the issues. People are saying skeptical of the vaccine. It took 40 years to develop this vaccine. Well, I mean, it took a decade to develop this vaccine, and here you have in a year. I'm not smart enough to, he was talking about the genetic sequence. This is a completely different vaccine. I was reading an article, and it was explaining what Dr. Black was referring to earlier. You're not using the actual virus to develop the vaccine, and that is apparently a generational leap from what's traditionally occurred. So what the city's going to be doing is recommending that the general public follow the advice of the medical community.
Dr. Royce, if you have a moment, please come up and speak to our question. Dr. Royce.
Well, I can speak from the public health side of that, and we haven't said a lot about it just yet, and the reason is because we haven't received our shipment. We don't want to build up too much excitement and not be able to deliver. But the moment that we get clarity on when our vaccine will arrive, that's when we will start to publicize the availability of it. We will use every means we can think of standard media, social media, billboards, and so forth. It's our intention to get the word out and to be transparent. We want everybody to know about this, and ultimately, our goal is to have everyone vaccinated who is eligible for it. You would probably need to talk to city and county leaders about the other angle of it, but we certainly plan to distribute the information widely as soon as we can. Our website is one place where current information will be posted quickly when we have it.
Thank you, Dr. Ruiz. Any additional questions? Okay. Thank you very much. And I'll just simply say from emergency management standpoint, we will certainly support community leaders and efforts through our Emergency Operations Center, communicating information that we receive. I think it's important that our citizens have accurate information, and they've certainly called on us during this pandemic to provide that, and our goal is to provide accurate information so that our citizens know where to go and to be, there are questions to be addressed appropriately, and that's our role, and we plan to do that. So thank you for asking that question today, and thank you, Dr. Ruiz and Mayor Doro, for addressing those questions. I think those are very important to our community to hear from you. Before we end today, I would like to say that our next press conference will not be on January 1st. That will be New Year's Day. We will be here New Year's Eve, December 31st. We will be here at 10 for our press conference just before we break for New Year's Eve and New Year's Day. So we will be here. We'll ask you to please join us then. And as I end all our press conferences and our briefings, mask up Albany, mask up Dougherty County. Thank you. I did, yes, sir. And I plan to